Right now, Americans without insurance don't like Obamacare. That was the theme after the Times wrote about their own healthcare poll. But is there more to the story and more to the numbers? We take a closer look. And then this town ain't big enough for both of them. Bloomberg and de Blasio butting heads now on the city budget. We're going to check in on that. Plus, the team de Blasio is putting together with less than 2 weeks to go. And later, it's the story that everybody seems to be talking about today, what some call Duck Dynasty's gay bashing, others call it free speech and religious expression. Can A&E's biggest moneymaker come back? And the better question is, should he? Good evening and welcome to RFL. I'm Richard French. Thanks so much for joining us this Thursday evening, December 19th. And we start tonight here with healthcare and healthcare reform. It's been the dominant theme here for the last few months, and trust me, it's going to be the big issue in Washington when the new year rings in. And it very well may define what is left of the Obama presidency. And while health reform hasn't always been popular, to put it politely, it has worked well enough helping the president win re-election until this. The bungled rollout of healthcare.org in October. It put the numbers in a nosedive and hurt Obama personally as well. Now today, the Times, they came out with this daunting headline, quote, uninsured skeptical of healthcare law in poll. And of course here, the success of Obamacare, it's based on those uninsured signing up here. And if the poll is right, that could be a huge problem. Inside, 53% of uninsured Americans say they disapprove of Obamacare. Not good, but just a sliver worse than the 51% of insured Americans who disapprove. Now, most people still most upset about the mandate, the requirement that people get health insurance. But if you dig just a little deeper, and the numbers for the president and for health reform, they get a little better. And here to go through them is our senior political correspondent, Andrew Whitman. And Andrew, people might say, oh, you're getting into the micro data of this. But how this thing is sold, how this thing is marketed, how this thing is spun, it'll determine whether it succeeds or fails. And in a large way, Andrew, it'll decide what the president can actually get done for the balance of his second term with the midterms coming up in November.
And keep in mind, Richard, there's Obamacare as it's written and being implemented, but there's also healthcare and healthcare reform in general. And as healthcare website has slowly gotten better since October, the numbers on Obamacare have slowly gotten a little bit better. But even people seem to have warmed to the idea and the ideology behind health reform. Take a look at these numbers. 54% of the Times poll say providing access to health care should be the responsibility of the federal government. 54% want D.C. in the health care game. Also, 70% of Americans say when individuals don't have health care, it hurts the country. 53% think health care for the poor is the responsibility of the federal government. But again, that's health care in the abstract. As for Obamacare itself, 37% of Americans say they still want a full repeal of Obamacare, but look at the other number. 53% say keep it and make it better. You can make the argument that Ted Cruz's rallying cry is getting more muted each day. And finally, the politics. Yes, Obama's disapproval rate is 55% on health care. And yes, Democrats are at 59% disapproval. But both of those are still way ahead of Republicans. 73% say they disagree with the GOP when it comes to health care. Rich?
All right, Andrew, thank you here. Now, I'm sure completely and vehemently disagree with Andrew is O'Brien Murray, Republican strategist, co-founder of New York Meeting, one of our favorites. Also Dominic Carter, always a favorite, political journalist and author. And we're going to let Andrew stick around as well here. Okay. How do you read the numbers?
I read the numbers that America is really uncertain about the future of Obamacare at this point. And I think when you look at it, right now we're talking about implementation, and that's the question. I've said on the show before, I've tried to go online and work with it and try to see what can be done. I really fear for what's going to happen on the first of the year. I think I've had conversations with people whose wives are pregnant and due in the end of December, and if they all of a sudden pass the first of the year and they have the baby the first week of next year, their life change is going to cost them thousands of dollars with family deductibles now, with lower rates but higher deductibles. You've got people that have cancer and other life-threatening diseases that have surgeries planned for January that all goes out the window now with new insurance. They've got to reschedule things and get new approvals and so forth. It is, right now you're talking implementation. I really fear for what's going to happen in the approvals and the disapproval of this issue once people find out they can't get what they thought they could get, and when they go and get the bills then again in March and April.
But what if they can get what they thought they can get?
I don't see it happening. That's the point. In other words, right now what people have, they know they have. I know what insurance I've had, you know it, Richard knows it, Andrew knows it. Once this all changes in January, it's a whole new experience for everybody, and there will be tons of stories about it not working.
But what if it's better?
Well, I'm just saying it won't be.
But what if
because
it's better?
not.
It won't be for
I'm not going to
everybody.
give
It
in on that
won't be worse for
hypothesis.
everybody
What I've
either.
heard about is everybody who's complaining about their fears of what's going to happen, and when those stories come out, that's going to be the challenge here. Right now, all we're hearing about is implementation on a website.
I think you touched on something, Obi. It's people's fears about what's going to happen, and they've been hearing a lot of negativity, a lot of negative stories about what's going to happen.
Domino effect.
In some unfounded stories about what's going to happen, particularly from one particular source. But beyond that, you seem to know a lot of people who don't have health care at work. With the stories that you're telling me, people who are they don't know what's going to happen if they don't get coverage as of January 1st.
Men and
you know
women,
a lot of people who aren't getting health care coverage at work, or that they're somehow
these are the
being
men
bounced
and
out of their
women-
insurance
These
policies.
are some of the millions of people that have received letters from their insurance carrier saying, you will not be covered as of December 31st. Your plan is gone. Somebody else told me a story. Their coverage
And-
was
but
cut
it's
off.
also
Their
here's
coverage was
another
cut off
plan.
in October. My friend's sister was cut off in October, had to get new insurance for a few months, and then new insurance again January 1st. This system is broken. It needs to be fixed in some way, shape, or form. It can't stand as is.
But Richard, as you've been pointing out night after night, did it work prior to Obamacare?
I think.
I mean, anybody can point out what's wrong.
Well, let's back up.
Did it
First,
work prior to Obamacare?
It worked better than what we're going into.
Really?
It worked better
With the
than we're going
HMOs?
into.
With the
It worked
HMOs?
better than we're going. That has
and
changed
what,
over time.
45 million's
Remember,
uninsured.
what we
It
wanted,
worked under that
what,
system?
What we wanted was a system where I could go to New Jersey or Connecticut and buy my insurance instead of just in New York. That's what we wanted to figure out what our insurance was. The difference is
you couldn't do
it's-
that before.
But no, that's what I'm saying. That's what we wanted the change to be. Right? You also have to have tort reform to try to bring the prices down. The only thing I can see positive out of this is the men and women now, when they make a decision on where to go get their medical services taken care of, and anything they've got to do for procedures, they will shop it better and maybe be more careful in where those dollars go. That's the only upside.
To put it politely, this will not be a seamless process as we go from the old way to the new way. But I do think it's instructive that of all the players, from the Democrats in Congress to the president to the Republicans, clearly the ones who have the lowest approval rating of the American public on this issue are Republicans. And I think it's for a basic reason. They didn't want to change anything. Time out. Until all of a sudden they try to get Obamacare pushed through. They were fine with the status quo with 45 million and projected to go up to 60 million Americans with no health insurance, and all the horror stories, for all you're saying about what could happen on January 1. Do you know all the stories we covered about people that literally had to go to the ER, they had nowhere else to go, and then they died for illnesses that could have been treated if they just got coverage, and they wouldn't get coverage because they had pre-existing conditions and all those things. I'm not trying to relitigate this thing right now, but the point is, I find it really rich that the folks that are complaining about some people being left out of the system couldn't have given two whits when 50 million Americans had no place to go. Now all of a sudden they're worried about somebody that's going to get kicked off, rightfully so, but all of a sudden they're worried about every American on the sidelines.
Well, at what point?
It is a little bit
at
of
what point does
hypocrisy.
this country say, those of you that are okay with something, we're going to change it all and really wreck it for you and fix everybody else that doesn't have it right now? Where's the equilibrium and what's right and what's wrong? There is a portion of life you have to say, let's take care of others and do what's right, right? That's the way we're all brought up and what we can do.
This is social
There's a
engineering.
portion of
But
how
let's
much.
not- let's be honest.
But there
This
is,
isn't
though.
social engineering.
Because what this president really wants is single payer.
Time
And
out.
this is his
Obi,
first step into
you
it.
got a kid
and we
who's
all know it.
26. All of a sudden, your kid at 26 would have health insurance
In
when
New
they
York,
normally would.
but in New York City, we already had that in New York City and New York State. That was already a New York State law. It didn't do anything for us.
Redistributing health care? They're taking
Really?
away from
What
the
they
haves
want?
and
No,
giving
this
to
is
the
just a
have-nots.
first step, because when it's broken, they'll say we have to go further. See, the Republicans stopped us from going where we wanted to go, and that Republican number you're talking about, as far as favorable, unfavorable, is not about one single issue.
Listen,
it's about a
time out,
terrible
Obi.
message.
Obi, the
at
rollout
times.
of this has been indefensible. I'm not going to try to, nor do I even want to try to defend on how this thing was done. There was an incompetence.
It's a
that they did-
stumble out, by the way, not a rollout. Let's make that very clear.
Well, okay, now let's put that in the commercial. But my point's a bigger one. Okay, but now what do we do about it? And if the Republicans misread this, like Andrew articulated with the numbers and the Ted Cruz of the world say, in this election year, hey, let's repeal the whole thing, they're going to make the biggest miscalculation. Use the capital they have right now on the issue and try and get the changes they want to have happen going
the
forward.
first thing we should have done is delay it when it came out and said you couldn't do it the right
They
way.
already delayed it.
No, they should have delayed it a full year. I should not have had my letter saying that I'm gone for the
We
next
know
year.
what's really
That's what
going
we
on
should
with
have
that,
done right
please.
there.
Rich, they don't get it. First it was repeal it and get rid of it. Now it's delay it as best you can.
No, it's repeal and replace. That's what the difference was.
Let's not get into
That's
the fact
the
that there is
message.
no replacement. It's been, what, what, 5 years? There's still no replacement. But the ship has sailed on healthcare reform. Americans want healthcare reform. They want the federal government involved in healthcare to make sure that people get it.
Too.
The numbers that we just went through show that the people want this. They want the government to do this.
They don't necessarily want this one that's forced down their throat. Millions of people received letters saying you are no longer covered as of the first of the year.
He screwed up when he said.
And that was a major problem.
He screwed up when he said, if you want it, you can keep it. I got it. Okay? That's not a little screw up. Big screw up. Website not working. Big screw up again. But it's here. Public gets it. Every governor said it's unsustainable. It is. You want to talk to hospital presidents and everybody who's ER doors with a place of last refuse. Everybody knows they had to do something about it. For the GOP, and Dominic always asks the right question: what's the alternative? For how long did they say no way, no how, no chance? It's not like they really wanted to amend it. Come on. They defended the HMOs until the cows came home. Now all of a sudden they're fighting for the little guy. Give me a break. Now, let's see if we can fix this thing.
But this president, as you bring up the lie about keeping it or not, right?
Lie. You said lie.
It's a lie. I did say lie, but you brought up
insurance companies who are revoking those policies. It's not the government. It's the insurance companies.
No, the government says they can't keep them.
No.
The government said
not this year. Not this year. They actually have until.
But they already sent the letters out.
Obie, they actually already have.
And then once
insurance
the letters
companies
are out,
had until 2015 to make those changes. They're the ones who kicked them out this year.
No, the original plan was if it was not a plan in place already that was not pre-approved, you could not keep it. That was the original plan.
All right,
they changed that over time. But let's just say this is the president.
I get it. But
please,
Richard, you're a smart enough guy to know when not every state opts into the plan. Okay? When different states have different rules, your hope of you can go shop across state borders, it's a load of you-know-what, okay? There are people that have been rooting against this thing and cheering for its failure from jump, okay? Which has made a difficult challenge even that much harder. The buck stops with the president, I get it. But if everybody's not pulling in the same direction, and they're certainly not, it makes it really easy to sit on the sidelines and throw stones. And that's where we are.
Where I was trying to go before about the lie being one part of this aspect, the other thing is this president says there's always rollouts. If you're Apple and rolling out a new product, there's a problem, okay? Well, what do you do when there's a problem? You postpone when it actually is for sale and when people will be able to use that product. That is something that this administration has failed to admit they were wrong on and failed to let us go further.
You got the last word. All right, when we come back, we're going to talk about two New Yorks here. I mean, the two New Yorks, the cities, two mayors here are describing. In one, the city doing A-OK. Financial health, if you can keep down labor unions here, wonderful. In the other, the city, it's on the brink of disaster, and it's the unions bringing down the mayor. We're going to debate here with the two guys on the screen how they look at New York and which one's closer to reality.